All right, so get this. Today, we're going deep on something that might just save your wrists someday.
And maybe your favorite sport, too.
Exactly. We're talking distal radius fractures, or DRFs, as the cool kids call them.
Specifically for us.
You active older folks.
Yeah, exactly.
We've got a dense medical textbook chapter as our guide today, and I gotta say...
Dense is right.
It is packed with info, like stuff you definitely won't hear just hanging around the gym.
No, you won't.
So are you ready to get nerdy with me on this one?
I'm always ready.
Okay, good. Because we're about to uncover some surprising truths about how our bones age, right?
Right.
And how treating these really common fractures, they aren't always so straightforward.
Especially for athletes.
Especially for athletes who just want to get back in the game, right?
Exactly.
So let's start with the basics for anyone who's maybe not familiar with the lingo.
Okay.
What exactly are we talking about when we say distal radius fracture?
Okay, so picture the two bones in your forearm.
Okay.
So the radius, that's the one on the thumb side.
Got it.
And the distal part, well, that's just the end closest to your wrist.
Makes sense.
So a distal radius fracture is a break in that bone right near the wrist joint.
Okay.
And get this, over 5,000 Medicare beneficiaries.
Wait, 5,000?
Yeah, over 5,000 every year experience these.
That's a lot of busted wrists.
It is.
Wow. Okay, now I'm really paying attention. So 5,000 Medicare beneficiaries every year with a distal radius fracture.
Yep.
What's the usual treatment?
Well,
is it always a cast?
You'd think, right?
Yeah, I would think so.
With a fracture, it'd be pretty clear-cut, but it's actually kind of a debate, especially for,
older athletes.
Older athletes, yeah.
Yeah.
There's been a big shift toward surgery in recent years.
Really?
But this textbook chapter we're looking at today, it brings up some important questions about whether surgery is always the best choice for older patients.
Hold on. So even if you break your wrist, surgery might not be automatic. What's the argument against it then?
Well, there's a few things to consider.
Okay.
This chapter mentions a key study. They call it the DASH study.
Okay.
And it looked at outcomes for folks over 65 who had DRFs.
Okay. Got it.
And what's fascinating is it found no major long-term advantage for those who had surgery.
Oh, wow.
Compared to those who didn't.
It's not what I expected.
Right.
Less surgery, though. Sounds good to me.
I mean, sure, but it's not quite that simple.
Oh, okay. What else is there?
So the study did find a higher rate of osteoarthritis later on in the group that had surgery.
Interesting.
So it's not just about fixing the break, right?
Yeah.
It's about the long-term impact on joint health.
Yeah, I mean...
No, that's an important thing to consider.
Yeah, no, the quick fix isn't always the best, long-term solution.
Right.
This is where I start to worry a bit, though.
Yeah.
Because I know bone density decreases as we age, right?
Right.
Does that mean we're more likely to have complications? Or take longer to heal?
That's a common concern. And you're right.
Yeah.
For the general population, bone density does decrease with age.
Right.
But here's the kicker.
Okay.
And this is what I love about this chapter.
Yeah.
Aging athletes,
people
like you who are still active, often have better bone density than their non-athletic peers.
So all those years of, pounding the pavement are actually helping protect my bones.
Exactly. It's like a bone-building bonus for staying active.
Wow. Talk about motivation to keep moving.
Right.
So better bone density, potentially faster healing. This is encouraging. Anything else aging athletes should keep in mind when it comes to these fractures?
One thing this chapter really emphasizes is realistic recovery expectations.
Okay.
Even with good bone density, healing takes time.
Right.
And for us, the seasoned athletes, it might take even longer.
How much longer are we talking?
Maybe double the recovery time compared to younger folks.
Double?
Yeah.
Ouch. Patience is definitely a virtue.
It is, especially when it comes to healing.
All right. So we've established that surgery isn't always the answer.
Right.
But I'm guessing there are situations where it asks us the better choice.
Absolutely.
So what makes a doctor say, okay, we need to operate on this one?
Well, there are specific factors surgeons consider.
Okay.
And they boil down to the severity and type of fracture.
Got it.
So things like how far the bones are out of alignment.
Oh, okay.
If there are any gaps or steps in the joint surface. And something called ulnar variance, which is basically the length difference between those two forearm bones.
Gotcha.
If those are off, It can really impact how your wrist works.
So they're looking for red flags that could affect how you use your wrist later on down the road.
Exactly.
Okay, so let's say surgery IS, the way to go.
Okay.
What are the main goals they're trying to achieve with the surgery?
The big three.
Yeah, lay it on me.
Getting those bones back into perfect alignment.
Okay.
They call that anatomical reduction. Then making sure they stay put with some internal fixation,
Okay.
which usually involves plates and screws.
Right.
And finally, getting you moving again as soon as possible.
Okay, yeah, so you don't stiffen up.
Right. Prevent stiffness and promote healing.
Makes sense.
They actually go into quite a bit of detail about the surgical approach itself in this chapter.
Okay.
Sounds pretty delicate.
Delicate.
Yeah.
Tell me more about that.
Okay, well, so think about your wrist for a second.
Okay.
It's not just bones, right?
No, there's all kinds of stuff in there.
You've got tendons, nerves, blood vessels, all these really vital structures crammed into a tiny space.
Oh, yeah. It is pretty small.
Surgeons have to be incredibly precise during surgery to avoid damaging anything.
Makes sense.
It's like microsurgery for your wrist.
Oh, okay. So they're working in a very confined space with a lot at stake. So what's a typical approach they take?
Imagine this. They make an incision over one of the tendons that helps you flex your wrist.
Okay.
It's called the flexor carpi radialis tendon.
Oh, got it.
Then they carefully move the tendons and nerves out of the way to get to the broken bone.
Oh.
It's like gently pushing aside the hands of a clock, you know,
I get it.
to get to the gears underneath.
Okay, so they're creating a pathway to the bone, I see.
Exactly.
And once they've got access, they can put those pieces back together.
Right.
Like a puzzle, basically.
Yeah.
And then those plates and screws, they're kind of like internal scaffolding, right?
You got it.
To hold everything in place while it heals.
That's a great way to put it.
So those plates and screws, that's what allows for early movement.
Exactly, by stabilizing the bones.
Yeah.
Surgeons can often get you started on some gentle exercises.
Oh, wow.
Pretty soon after surgery.
Okay, so it's like a delicate dance between stability and mobility.
It is.
Trying to find that sweet spot. That promotes healing without causing more damage.
You got it.
Okay, this is all super insightful.
Good, good.
Before we move on, I want to touch back on something you said earlier about rehab.
Okay.
You mentioned it's really important for us older athletes.
Oh, it's crucial.
What does that look like, you know, in those early stages after a fracture?
So,
both for those who have surgery and those who don't.
Right. So after surgery, you'll probably be in a splint for a couple of weeks.
Okay.
To protect the wrist.
Right.
But here's the difference.
Okay.
Unlike a cast, a splint, you can remove it.
Oh.
For those gentle exercises we talked about.
Ah, so they get you moving pretty quickly after surgery then.
Yeah, we try to.
What about for those who don't have surgery?
If you're going the non-surgical route, you're probably looking at around 6 weeks in a cast.
6 weeks, okay.
To let the fracture heal.
Yeah.
But it's not total immobilization.
Oh, good.
You'll be encouraged to keep your fingers and elbow moving.
Okay.
To keep the blood flowing, you know.
Right, to prevent stiffness. Exactly.
So even with a cast, they're trying to minimize the negative effects of not moving those surrounding areas.
Exactly.
It seems like a lot of thought goes into this whole process.
It does.
It's not just about fixing the break. It's about restoring function.
Absolutely.
Especially for those of us who want to stay active.
Couldn't have said it better myself.
Speaking of getting back to an active life.
Yes.
Let's talk more about that bone density paradox.
I love this part.
I think our listeners are going to find this really fascinating.
I think so too. It's funny, you know, when we think about getting older, we tend to focus on what we lose.
Right, like our strength.
Strength, flexibility.
A little bit of hair, maybe.
Yeah, exactly. A little less hair.
But this idea that we aging athletes might actually be ahead of the game.
Yeah.
When it comes to bone density, it's kind of cool.
It's a nice twist, yeah.
It's like this secret weapon we've been building without even knowing it.
Absolutely.
How much of an impact does it really make, though?
I mean, does it just mean we heal faster?
It's a good question.
Or are there other benefits too?
This chapter really makes a strong case.
Okay.
For the idea that better bone density isn't just about healing faster. It's about, you know, like overall resilience.
Okay.
Think of it this way. Stronger bones. Less likely to break in the first place.
Makes sense.
And if they do break,
yeah,
they can handle the stress of rehab exercises better.
Okay, so it's like having a sturdier frame
to
work with.
Yeah.
Okay, that makes a lot of sense.
Good.
You know me, though.
I do.
I always want specifics.
I figured.
What kinds of activities are we talking about here that can really help us maintain or even improve bone density as we age?
Right. Well, anything weight-bearing is key.
Okay, so like what?
Walking, running, dancing, hiking, even stuff like tennis or pickleball, where you're changing direction a lot.
Yeah.
Putting stress on those bones.
Don't forget strength training.
Of course, strength training.
Super important.
So important.
All right, so it's not just cardio.
Nope.
It's about a mix of things that really challenge our bones and muscles.
Exactly. That combination is key.
Okay, I'm taking notes. Gotta add some extra weight training to my routine.
Good, good.
But let's say, despite our best efforts, a fracture does happen.
It happens.
We've talked about the surgery itself, but what about afterwards?
Right.
What's recovery like for someone who's had their wrists put back together with all those plates and screws?
It's a process, for sure.
Yeah.
It's all about gradually getting back to normal function.
Right, but those first few weeks are crucial though, right?
They are. They are.
You probably have that splint on for a while.
You'll likely have a splint on for a couple weeks, yeah.
Okay.
To protect the wrist, but...
But you said you can take it off for exercises, right?
You can. Unlike a cast.
Oh, that's good.
You can remove the splint for those gentle exercises we talked about.
So they really do get you moving quickly.
Yeah, it's important.
Yeah. What kind of exercises are we talking about, though?
Well...
I'm picturing, like, tiny wrist curls with a feather.
No, not quite that light.
Okay.
It starts really basic.
Okay.
Think simple range of motion.
Yeah.
Like bending and straightening your fingers.
Gotcha.
Maybe some gentle wrist circles.
Okay, so just keeping everything moving.
The goal is to keep those joints lubricated, prevent scar tissue from building up.
Okay, so starting slow and steady.
Exactly.
But it ramps up from there, right?
Yeah, yeah.
When do you start doing, like, more functional movements?
Okay, well...
Like gripping things or lifting?
That's where the rehab specialists come in.
Okay, the pros.
The pros, exactly.
So usually around the 2-week mark?
Yeah, about 2 weeks after surgery.
Okay.
You'll start working with a physical or occupational therapist.
Got it.
And they'll guide you through a more structured program.
So they tailor it to your needs?
They do. They take into account your age, your activity level, even the specific demands of your sport or hobbies.
That's reassuring.
Good.
Now, what about those who choose to go the non-surgical route? Is rehab similar?
The principles are the same.
Okay.
But the timeline's definitely longer.
Yeah, that makes sense.
With a cast, you're looking at about 6 weeks of immobilization to let that fracture heal.
6 weeks. Wow.
But it's not complete inactivity.
Oh, good.
You'll be encouraged to keep those fingers moving, that elbow moving.
Right. Keep the blood flowing.
Exactly. Prevent stiffness in those joints.
So it's like they're trying to minimize the damage, so to speak.
Yeah, minimize the negative effects, for sure.
Of having that part of your body immobile for so long.
Right, exactly. And it makes a big difference once the cast comes off.
Yeah, I bet.
And you start rehab.
Okay, so once the cast is off.
Then you start with those gentle range of motion exercises.
Okay.
Gradually progressing to strengthening.
Got it.
And more functional movements, just like after surgery.
So it's the same stuff.
Yeah, basically.
Just on a different timeline.
Right, but be prepared. It might take a bit longer.
Oh, okay.
To regain full strength and mobility.
Because of that longer immobilization period.
Exactly.
So no matter which way you go, early rehab is key.
It's essential.
It's all about that gradual return to function, right?
Uh-huh.
Respecting the healing process, but pushing those boundaries little by little.
Couldn't have said it better myself.
And it's important to remember that rehab isn't just about the exercises.
Oh, right. It's more than that.
It's about managing the pain.
The pain, the swelling.
Yeah, understanding your limits.
Knowing your limits.
Yeah, and gradually adapting your activities to protect your wrist.
Exactly.
As it heals.
It's really a holistic approach, you know?
I like that.
Thinking about the whole person, not just the injury.
And that's where having a good therapist is so valuable.
Oh, absolutely.
They can really guide you.
They can, and they keep you motivated.
Yeah, through all of that.
You're right. And speaking of motivation,
there's
another point this chapter makes. That, I think, is really interesting, especially for aging athletes.
Okay, I'm all ears. We've talked a lot about bone health and rehab.
We have.
But let's be real.
Okay.
Dealing with a fracture, especially as we get older, it's not just about the physical stuff.
Right. It's not.
It's about managing how you feel, too.
Absolutely. The mental and emotional side of things.
That's accurate.
That's huge.
And this chapter, it actually talks a good bit about pain management.
It does.
Which they say is often overlooked, especially when we're talking about treating older patients.
It's true. It often is.
And they emphasize how pain can really impact recovery.
Yeah.
Not just physically, but mentally and emotionally, too.
It really can.
I can see that. If you're in pain all the time, it's got to be hard to focus on doing those exercises.
Exactly. It makes it so much harder.
And it can really mess with your mood, your motivation.
For sure.
This is where those realistic expectations come in, right?
It is. It's about understanding that pain is normal.
Yeah.
It's part of healing.
But also knowing when the pain might be a sign of something more serious.
Right, exactly.
The authors really stress that open communication with your doctor or your therapist.
So important.
Don't try to tough it out.
No. Don't.
If the pain's bad, if it's keeping you from doing your everyday stuff.
Or your exercises.
Talk to someone.
Absolutely. Speak up.
It's a two-way street. We've got to be proactive about managing our pain.
Right.
But also advocate for ourselves.
Yes.
Let our healthcare team know what's going on.
They're there to help.
What about the mental and emotional stuff, though?
Yeah.
I mean, it can't be easy being sidelined from the activities you love.
No, it's not.
Especially when you're used to being active.
And independent, yeah. It's tough.
This chapter even mentions the potential for things like
frustration,
anxiety,
depression even.
Yeah, during the recovery process.
Especially for older athletes who really, identify with that active lifestyle.
Yeah, it's like losing a part of yourself.
You can feel that way.
So how do we stay positive?
It's a good question.
And motivated throughout the process.
Well, first of all, acknowledge those feelings.
Yeah, okay.
It's okay to be frustrated.
Right.
It's okay to feel down. Don't beat yourself up about it.
Just don't ignore it.
Right. And instead, focus on what you can control.
Okay, I like that.
Set small goals.
Little by little.
Exactly. Whether it's doing your exercises, taking a short walk.
Just getting outside.
Yeah, just getting some fresh air.
I like that, breaking it down into those smaller steps.
It helps.
Because it's easy to get overwhelmed looking at the big picture.
It is.
But focusing on those small wins, that can really help keep you going.
It can.
And I bet having a good support system is important, too.
Oh, so important.
Friends, family, maybe even connecting with other athletes who've been through the same thing.
Absolutely. Sharing your experience with others who get it.
Yeah.
It can really help. It can make you feel less alone.
Normalize those feelings.
Exactly.
And provide some encouragement.
And don't forget about the power of positive self-talk.
Oh, right. Got to keep that inner voice positive.
Remind yourself that this is temporary.
You're strong. You will get back to doing the things you love.
You will.
It's all about focusing on that light at the end of the tunnel.
It is.
Remembering that even though the journey might be a little bumpy, you'll get there eventually.
You will.
Wow, this has been such an eye-opening conversation.
It has.
We've covered so much.
We have.
From the details of these fractures to the bigger picture stuff about aging and staying active.
Absolutely. Taking a holistic approach.
I feel empowered.
Good. That's what we want.
I'm walking away from this with a much better understanding of not just DRFs, but of how I can take control of my bone health and approach recovery with the right mindset.
That's great to hear.
Should I ever, find myself with a busted wrist?
Exactly. Knowledge is power.
It is.
And the more we understand about our bodies, how they heal,
the better equipped we are to make good decisions about our health.
Couldn't agree more.
And on that note, we want to thank you for joining us on this deep dive.
Thanks for listening, everyone.
Into the world of distal radius fractures.
In aging athletes.
We hope you learned something new.
And maybe even had a few laughs along the way.
Keep those wrists strong and those minds curious.
And keep moving.
Until next time.
Happy trails.